Bismillah ar-Rahman ar-Rahim. It is exactly 8:23 a.m. Now, South African coronavirus cases are beginning to climb. The positivity rate of tests is increasing, and an analysis of wastewater has shown that the disease is once again becoming more prevalent in some parts of the country, particularly here in Gauteng. To talk to us about this trend is senior health reporter at Bhekisisa, and she is Aisha Abdool Karim. Welcome to the show, Aisha. And we understand, obviously, over the past 2 weeks, we've seen an increase in COVID cases. Does that mean we are now formally entering the fourth wave?
Good morning to you and to all your listeners. So I think at this stage, it is too early to say for sure that we are entering a fourth wave. The case numbers and the positivity rates have been rising in certain areas, so it's possible that these could just be small outbreaks rather than indicating that the country is heading into the fourth wave. We are expecting a fourth wave to come by around mid-December, but of course we can't really know for sure with this virus. We've seen it's been very unpredictable, which is why the scientists are watching very closely to see if this rise that we're starting to see, particularly in Gauteng, is indicative that we are, heading into the fourth wave, or if it's just a few small outbreaks that locally and are not yet spreading across the country.
Now, I know it might be too early for you to tell, or for the scientists to start, thinking about this issue, but would we know what variant we'll be faced with when we're into the fourth wave?
So at the moment, the variant that's currently still the main one that we're facing is the Delta variant. So that's the one that was first identified in India. And that was what drove the large spike in cases that we saw during the third wave. So that variant continues to be the main one of concern in South Africa. We do have a genomic sequencing network in South Africa. So their job is basically to track the virus throughout the country, and they keep an eye out for variants. The issue with sequencing is that it does take a few weeks. So they collect the samples from people who have gone for a COVID test, and then they check to see, what is the genetic code for that particular virus that someone has tested positive for. And that's how they figure out if it's the same version of the virus that we already have in the country, or if there's possibly something new. So at the moment, what they found is that the variant that we currently have is still the Delta variant. But, it is possible that as they continue to sequence, and perhaps as we head into the next wave, there may be a new variant. But that is what that network exists to do. They exist to monitor which version of the virus is circulating in the country, and they report if they see any new variants cropping up.
Now, I know my next question, is no one can give an exact answer to it, but let me put it to you anyway. You also indicated that we expecting to see the fourth wave possibly hitting us by mid-December. That being said, what sort of an impact can we expect during or possibly after the holidays if we do hit that fourth wave by the middle of December?
So obviously December is a period of concern because that is when people are moving around the most, and that's how the virus spreads. As people move, the virus moves with them, and that's generally why we expect that around the holiday season, when people are seeing each other and maybe being a bit more lax about, following the safety protocols, such as, wearing their masks or sanitizing, or, you have much bigger gatherings around the holidays. And so that's why there is an expected spike in cases around this time, as people, go to spend time with their loved ones, or go on holiday, or whatever it is. At the moment, we aren't quite sure what to expect from the fourth wave. There is a hope that this wave will not be worse than the previous wave. So what we saw during our second and third waves was that there were new variants entering the country, and they drove, mass spikes in the cases. And that was why, our trend has been that each wave has been worse than the last. For now, because it does seem like the variants, we don't have a new one, and it is still the Delta variant, and because the vaccination numbers are rising, the hope is that as we enter the next wave, enough people will have some form of protection, either from, previously being infected and recovering, or through vaccination. And so hopefully what we'll see is that this time around, either there will not be as many new cases as we've previously seen, or there will be new cases, but there will be less severe cases. So that's less people needing to go to hospital and fewer people dying as a result of COVID.
Okay, and finally, I know there's been talk about booster shots in other parts of the world. I'm wondering, with South Africa, with the possibility of a resurgence of COVID, would booster shots and vaccination of preteens perhaps help curb the resurgence?
Yeah, so I'll start with the vaccination of teenagers. So in South Africa, teenagers, or young adults between the ages of 12 and 17 can get their first dose of the Pfizer vaccine. And the reason why teenagers are an important group to reach is that while they may not be at high risk of developing severe disease, they can drive transmission, which means that basically they can get infected and then they spread it to other people. Particularly, it's something that we've seen within schools. And then when it happens in a school, people take it home and then their families get infected. So teenagers are an important part of the vaccination rollout, because protecting them can help reduce the chances of new cases and can lower the chances of more people being infected. When it comes to boosters, currently South Africa is only giving boosters to healthcare workers who received a Johnson & Johnson shot through the Sisonke trial earlier this year. But Pfizer has applied to the country's medical regulator to approve an extra dose for people. That extra dose, those booster shots, who they are really important for are people who are at high risk. So that is people that you are worried about because their immune systems are compromised, or because they're more likely, to have a more severe case of COVID. So what you're looking at there is healthcare workers, because they are the most at risk in terms of their exposure to the virus. You're looking at older people because their immune systems are weaker, and so they're less likely, to have the needed immune response after the standard number of doses. And that also applies to people who have weakened immune systems, such as people who have HIV and are not, on treatment, or people who, cancer patients who are on chemotherapy, people who have had organ transplants. So there's a list of people who are exceptionally vulnerable, because their bodies aren't able to protect them enough after the standard amount of doses. And so that's really who boosters are targeted at. But as I said, in South Africa, we haven't yet gotten to that stage past just allowing healthcare workers to get boosters.
Thank you indeed for your time. Aisha Abdool Karim, Senior Health Reporter at Bhekisisa, talking to us about the possible resurgence of a fourth wave of COVID. The time is exactly 8:34. News and views on Salam Media.
Durban, KwaZulu-Natal has been the hardest hit by